A 48-year-old father of two woke up, brushed his teeth, and felt just a little tired. Not pain, not panic, just a strange heaviness in his chest and a bit of nausea. He thought maybe it was something he ate. He went to work anyway. By noon, he was gone. No warning, no dramatic collapse, no crushing chest pain like you see in movies. Just a silent heart attack, one that whispered instead of screamed. Here's the terrifying truth. Millions of people experience heart attacks without even realizing it. According to global health reports, nearly 1 in 5 heart attacks are silent, meaning the damage is happening quietly while you continue your normal life. So let me ask you something very important. What if your body is trying to warn you right now, and you're missing the signs? Stay with me, because what you learn today could literally save your life or someone you love. Hello, I'm Dr. Emmanuel, a board-certified cardiologist with an MBBS from a top medical university and over 15 years of experience specializing in cardiovascular health and disease prevention. Throughout my career, I've worked with patients across all age groups.
The ST elevation is significant here.
The troponin levels confirm the myocardial infarction.
We need to get him to catharsis immediately.
From young adults in their 30s to elderly individuals in their 70s and beyond. Many of them had one thing in common. They never thought a heart attack could happen to them, especially not silently. I have trained in advanced cardiac care, worked alongside some of the most respected specialists in the field.
As you can see, the blockage is significant here in the left anterior descending artery.
But look at the collateral circulation here.
And handled emergency cases where minutes made the difference between life and death. But what truly changed my perspective was seeing how many heart attacks could have been prevented if only patients had recognized the early warning signs. Welcome to BioQRX Clinic, where you find all solutions from true professionals. Your trusted source for deep health cure, proven treatments, and life-changing advice from board-certified experts dedicated to your wellness journey. This is not just another health channel. This is your frontline defense against diseases that don't announce themselves. Here, we break down complex medical science into simple, powerful knowledge that you can actually use in your daily life. Today's topic is something most people underestimate: silent heart attacks. You might feel healthy right now. You might think, that won't happen to me. But by the end of this video, you'll understand why awareness is your strongest weapon and why ignoring subtle signs could be the biggest mistake of your life. What exactly is silent heart attack signs and prevention? A silent heart attack, medically known as a silent myocardial infarction, is a condition where the blood supply to a part of your heart muscle is blocked. But the symptoms are so mild, vague, or unusual that they go unnoticed. Now let me explain this in a way that makes complete sense. Your heart is like a powerful engine. It works non-stop, pumping blood to every part of your body. To keep running, it needs oxygen, which is delivered through blood vessels called coronary arteries. When one of these arteries becomes blocked, usually due to cholesterol buildup or a blood clot, the heart muscle starts to get damaged. That's a heart attack. But here's the dangerous twist. Not every heart attack comes with dramatic chest pain. Some are quiet, subtle, almost invisible. Instead of intense pain, you might feel something like a little discomfort, a slight pressure, a strange fatigue, or even nothing at all. This is why it's called silent. Not because nothing is happening, but because your body isn't screaming, it's whispering. And here's the frightening reality. Many people only discover they had a silent heart attack during routine medical tests, weeks or even months later. By then, permanent damage may already have occurred. Think of it like a fire starting inside your house while you're asleep. There's no loud alarm, no smoke you notice immediately, but the damage keeps spreading silently. Now imagine, what if your body has already experienced this and you don't even know it? Let's move deeper, because your body does give clues. You just need to know how to read them. Hidden symptoms. You must know this is where things get serious. Silent heart attacks don't come with textbook symptoms. They come disguised as everyday discomforts. And that's exactly why people ignore them. Let me walk you through the warning signs you should never overlook. Unusual fatigue is one of the most common signals.
Based on
This
the
isn't
EKG and the
normal
stress test
tiredness
results,
after
your
a
heart
long
function
day.
is strong.
This
the
is
chest pains
deep,
aren't cardiac-related,
unexplained
we need to look at
exhaustion
other
that feels
possibilities,
out of
perhaps
proportion
muscular.
to your activity. You wake up tired. You feel drained doing simple tasks. Your body feels heavy for no clear reason. Mild chest discomfort is another key sign. Notice I didn't say pain. It may feel like pressure, tightness, or a squeezing sensation. Many people mistake this for gas or indigestion. Shortness of breath is a major red flag. You might find yourself getting winded while doing simple activities like walking or climbing stairs. Your heart is struggling, and your lungs are trying to compensate. Pain in unexpected areas is very common. Jaw, neck, shoulders, back, or even arms. These are called referred pain signals, and they can confuse even experienced patients. Nausea or stomach discomfort is often overlooked. Many people assume it's something they ate, but in some cases, it's actually your heart sending distress signals. Cold sweats can appear suddenly, even when you're not physically active. Your body goes into stress mode, and sweating is part of that response. Dizziness or lightheadedness may occur because your brain isn't getting enough oxygen-rich blood. Here's the key insight. These symptoms are often mild individually, but when they appear together, they form a dangerous pattern, and most people miss it. So the real question is, why does this happen in the first place? What's silently damaging your heart over time? Silent heart attacks don't appear overnight. They are the result of long-term damage building inside your body, often without any obvious signs. Let's break down the real causes. High blood pressure is one of the biggest contributors. It puts constant pressure on your blood vessels, causing tiny injuries over time. These injuries become the starting point for plaque buildup. High cholesterol is another major factor. When LDL cholesterol levels are high, it starts sticking to the walls of your arteries, forming plaque. Over time, this narrows the passage for blood flow. Diabetes is especially dangerous. It not only damages blood vessels, but also affects your nerves. This means your body may not even feel the pain signals properly, making heart attacks silent. Smoking damages the inner lining of blood vessels and accelerates plaque formation. It's like pouring fuel on a slow-burning fire inside your arteries. Obesity and lack of physical activity weaken your cardiovascular system. When your body isn't moving, your heart isn't being trained to stay strong. Chronic stress plays a huge role. Stress hormones increase blood pressure, cause inflammation, and disrupt normal heart function. Poor diet is the silent killer. High sugar, processed foods, and unhealthy fats slowly destroy your cardiovascular health over time. Think of your body as a machine. Every unhealthy habit is like adding dust and damage inside the system. It doesn't break immediately, but eventually it fails. But here's the powerful part. You can change this. Let's talk about what actually works to protect your heart. Proven treatments and home remedies when it comes to silent heart attacks. Early action can make all the difference. Medical treatments often include medications to control blood pressure, reduce cholesterol, and prevent blood clots. These are essential for high-risk individuals. But real transformation happens when you combine medical care with lifestyle changes. Start with your diet. Think of food as medicine. Focus on natural, whole foods, fruits, vegetables, whole grains, lean proteins, and healthy fats. Avoid processed foods, sugary drinks, and excessive salt. Movement is critical. You don't need a gym membership. Even 30 minutes of walking daily can significantly improve your heart health. Stress management is not optional, it's essential. Whether it's deep breathing, meditation, or simply taking time to relax, your heart needs calm as much as it needs oxygen. Sleep is another powerful tool. Poor sleep increases your risk of heart disease dramatically. Aim for at least 7 hours of quality sleep every night. Regular health checkups are your safety net. Blood pressure, cholesterol, and blood sugar levels should be monitored consistently. And if you smoke, this is your wake-up call. Quitting smoking is one of the most powerful decisions you can make for your heart. But sometimes, facts alone don't change behavior. Stories do. Let me share something real. Real patient stories. I once treated a patient named Farhan. He was 50, active, and believed he was healthy. He came in complaining of mild fatigue and occasional back discomfort. Nothing serious, he thought. But tests revealed he had suffered a silent heart attack weeks earlier. He was shocked. "Doctor, I never felt anything serious," he said. Another patient, Aisha, experienced nausea and jaw pain for days. She thought it was stress and acidity. By the time she came in, her heart function had already been affected. These are not rare stories. These are everyday realities. And they all have one thing in common: ignored signals. So how do you make sure you're not next? Prevention is your strongest defense. Start by knowing your numbers: blood pressure, cholesterol, and blood sugar. These are your health indicators. Maintain a healthy weight. Even small weight loss can significantly reduce your risk. Stay active. Consistency matters more than intensity. Eat clean. Focus on natural foods and avoid processed junk. Manage stress. Your mental health directly affects your heart. Avoid smoking and limit alcohol. And most importantly, listen to your body. Because prevention is not about perfection. It's about consistency. But there are still many misconceptions out there. Let's clear them up. Myths busted. Many people believe heart attacks always come with severe chest pain. That's not true. Silent heart attacks prove otherwise. Some think only older people are at risk. But younger individuals are increasingly affected due to lifestyle factors. Others believe that if they feel fine, they are healthy. But many conditions develop silently for years. And some assume exercise alone is enough. But without proper diet and stress management, the risk remains. Understanding the truth gives you control. And now, let's go one step further. Advanced tips from BioCureX at BioCureX Clinic. We focus on prevention and early detection. We recommend regular ECG screenings, especially after the age of 40. Advanced blood tests can identify hidden risk factors before symptoms appear. Personalized health plans ensure that your diet, exercise, and lifestyle are aligned with your specific needs. We also emphasize proactive monitoring, because waiting for symptoms is not a strategy. The future of healthcare is prevention. And the sooner you adopt this mindset, the better your outcomes will be. Because your heart doesn't fail suddenly. It fails silently over time. Silent heart attacks are one of the most dangerous threats to your health, not because they are rare, but because they are unnoticed. Your body doesn't always scream for help. Sometimes it whispers. And if you're not paying attention, those whispers can turn into life-changing consequences. Today, you've learned the signs, the causes, and the strategies to protect yourself. You now know that fatigue, mild discomfort, breathlessness, and even nausea can be signals from your heart. You understand that lifestyle choices play a powerful role in either protecting or damaging your cardiovascular system. But knowledge alone is not enough. Action is what saves lives. Start small. Make better food choices. Move your body daily. Manage stress. Get regular checkups. And most importantly, never ignore what your body is trying to tell you.
Based on the EKG and the stress test results, your heart function is strong.
So the chest pains aren't cardiac related?
We need to look at other possibilities, perhaps muscular.
If this video opened your eyes, don't keep it to yourself. Like this video, share it with your family and friends, and help spread awareness. Because you never know who might need this information today. Subscribe to BioCureX Clinic for more expert-driven, life-saving content designed to keep you informed and protected. And I want to hear from you. Have you ever experienced any of these symptoms? Comment below and share your story. Your experience could help someone else recognize the warning signs in time. If you're serious about taking control of your health, book a consultation with BioCureX Clinic. Our experts are here to guide you every step of the way.